Hi, my name is Dr. Mike Hamilton. I'm the director here at the Rockcastle Regional Hospital.
My name is Tracy Bullins. I'm the Infection Control Coordinator at Rockcastle Regional Hospital and Respiratory Care Center.
We're all trying to adjust to this times that we're going through currently. What we have to realize is there's still emergencies that require us to come to the emergency room. Strokes, heart attacks, uncontrolled bleeding, broken bones, things like that don't take a break for the pandemic. If you have an emergency, we certainly want you to continue to come to the emergency department to be cared for. Certainly if you're home and you're feeling chest pain or other symptoms that could be consistent with a heart attack, shortness of breath, we don't want you to be afraid to come to the emergency department. We want you to get there in time to be cared for and not wait until it's too late for us to help you.
Visitors and patients, when they come to Rockcastle Regional Hospital, are screened. They come in through one of our entrances. They are asked questions about any contacts they've had, whether or not they have any sick symptoms that may be consistent with COVID-19. They'll also have a temperature check.
We have always been careful about washing our hands, using hand sanitizer in between patients. It is even more important during this pandemic. You will see us wash our hands in between patients going in the room, coming out of the room. There's hand sanitizers at every workstation we have. We utilize those in between each patient as well to try to prevent any kind of contamination.
So our ED department, we have always cleaned our rooms in between patients. Our staff wipe down the stretchers that patients are on, and so that's still part of the process. But if we have a suspected COVID patient, that cleaning immediately after the patient is discharged by the nurse, and then we wait an appropriate amount of time, and then housekeeping, our environmental services staff would come in and clean the room from top to bottom. Employees, when they report for duty at Rockcastle Regional, they are screened every time before they start their shift. They have a temperature check, and if anyone has a temperature 100.0 or greater, they are not allowed to work. Anyone with signs or symptoms of COVID-19 are not allowed to work as well if these are new onset of symptoms, and they are actually sent to be tested to make sure that we're not having anyone coming in providing care for our patients that could be sick with COVID-19.
Emergencies don't take breaks despite the pandemic. We will continue to be here to provide the best care for your emergency condition.